when he couldn't be trusted with something as simple as insulating the nation's homes. He could not be trusted with fixing schools, he could not be trusted with fixing roofs, and he should not be trusted with the nation's public hospital system. But you see, Mr Speaker, this Prime Minister has form. This Prime Minister has form when it comes to public hospitals. Not for nothing was he known as Dr Death when he was in Queensland. Not for nothing did they call him Dr Death, because the first thing he did when he was the Director General in Queensland...
The Leader of the Opposition will resume his seat. The Leader of the Opposition will resume his seat. The Leader of the Opposition will resume his seat. The Leader of the Opposition will resume his seat. The Leader of the House on a point of order. The Leader of the House on a point of order.
I ask that that be withdrawn, Mr Speaker.
Order. The Leader of the Opposition will refer to members by their parliamentary titles, but seeing that it has been raised, if he's the Leader of the Opposition.
I accept that admonition. Let me conclude.
And Mr Speaker,
and I will
order.
withdraw.
No. Order. The Leader of the Opposition will resume his seat. Order. Order. If people were not shouting so much that they could not read what was happening in the House, they might sit quietly. The Leader of the House.
And I move that the Leader of the Opposition's time be extended by 5 minutes.
Order. Order. The question is that the Leader of the Opposition... Order. No. Order. The question is that the Leader of the Opposition's time be extended. All those of that opinion say aye. Of the contrary, no. The ayes have it. The Leader of the Opposition.
And Mr Speaker, I will happily stand here and talk right out question time, Mr Speaker. Happy to talk out question time, Mr Speaker. But Mr Speaker, let me make this. Let me make while
Order.
members.
The member for Deakin is warned. While the Leader of the Opposition has the call.
Mr Speaker, while members opposite are terribly embarrassed, and understandably embarrassed, by the Prime Minister's record in health, in public hospitals, when he was the Director General of the Queensland Public Service, let me make these important points. What do our public hospitals right around Australia need right now? First of all, they need more beds, and second, they need local control. What did the Prime Minister do when he was the top public servant in Queensland? The first thing he did was he cut 2,200 beds out of public hospitals. Great record, some hero, some Mr Fix-It he was in Queensland. The second thing he did in Queensland was he abolished the local boards. Now, this is typical of this hypocrite and phony who we have in the highest elected office in this country. He stands up, puts his hand on his heart and says, "I've always supported local control of public hospitals." Wrong. He abolished the public hospital boards, which had done substantially a good job in Queensland for many decades, as almost the first thing he did when he became Queensland's top public servant. Now, Mr Speaker, because this Prime Minister is a man who is slippery with the truth, he tries to avoid the legitimate questions that are put to him not just by members on this side of the parliament, but even by the state Labor premiers. I put the questions to him that he needs to address in the 10-minute speech that he is about to make. who will administer the case mix funding system that he says is the salvation of the public hospital system? Don't yawn, Prime Minister. Answer the question. Don't stare at your notes. Listen, make some notes and you might actually be able to answer this question. Who will administer the case mix system? What is going to happen to the public servants currently with the Victorian government who understand it? Will they march en masse to Canberra? How are the local hospital networks actually going to be established? Who will run them? Will they be determined by federal law and federal regulation, or will it entirely be a matter for the states? If the states don't actually meet their requirement to put in 40% of funding, what penalties will be imposed on them? Does he give a guarantee that no country hospital will close as a result of his case mix funding? That's the question on the lips of just about every person in rural Australia right now. Will their public hospital be safe under the amateur hour experimentation that they will get from this Prime Minister, who couldn't even organise to give pink bats away almost for free? These are the questions that this Prime Minister has to answer, and above all else, what is going to happen to the funding? Now we know that he is going to confiscate 30% of the state's GST funding. How can we be confident that this Prime Minister will be any better using that GST money on health than he was using tax funding on home insulation or building the education revolution? The premiers know that they can't trust this man. That's why they are not prepared to sign up to his hospital plan until they've seen the details. They know they can't trust this man. That's why they're not prepared to sign up until they've seen the Henry Review. They don't think they can trust this Prime Minister, and if his own Labor premiers don't trust him, why should I trust him, and why should the Australian people trust him?
Order. 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 When the House comes to order, we'll continue. Prime Minister.
Thank you, Mr. Speaker. It's good to have Mark Latham back. Mr. Speaker, not in the pages of the Financial Review today, but here at the dispatch box opposite. Mr. Speaker, on the substance of health policy, what we've had finally, after an entire week in this place, is an intervention by the Leader of the Opposition on health and hospitals policy. Day by day we've waited for a question, but we have waited in vain, because it took today and the challenge to the Leader of the Opposition to come to the dispatch box and just say something, however little, however small, however insignificant, about health and hospitals. So, Mr. Speaker, I posed the Leader of the Opposition a question before, which was, does he support or does he oppose the government's health policy? I thought that was a pretty reasonable question, not to ask him day one after the policy came out, not even day two, but you'd think 2 weeks later he might have formed a view. And so his defined, definitive position on the health and hospitals policy of the Government of the Commonwealth of Australia is, I question all of it and I oppose most of it. Well, Mr. Speaker, that is the definitive conclusion on the part of the Leader of the Opposition. In other words, give me a fence to sit on for a few more weeks, a few more months, wait to see where the weather vane turns, and then make a decision, because the Leader of the Opposition knows a lot about weather vanes. He knows that the weather vane actually constitutes his moral compass. That is, whichever way it blows, so then will he take the politics of his position. And on the way through, Mr. Speaker, he made this extraordinary claim about the cancer centre up there in Darwin. Right. Mr. Speaker, he said it should be called the Tony Abbott Cancer Centre. Did I hear that correctly? Mr. Speaker, the Minister for Health reminds me that, in fact, I got it wrong. I said earlier today that they had promised it prior to the last election. I got it wrong. They promised it prior to the last 2 elections.